Welcome back to the Disenfranchised podcast. I am your host, Travis Gearhart. I am here with
Keith Cunningham.
And we are joined today by Jodi Allen. Thank you so much for coming on, Jodi. So to give some quick background stuff, and then I'm pretty much just gonna hand it over to you and let you do your thing. So, Jodi, what is your exact title then?
Sure. So it's a lot of letters, which are a DNP and then FNP-C, which just means that I have my doctorate in nursing practice and I'm a board certified family nurse practitioner.
Okay. I just wanted to make sure if it was supposed to be you know what I mean? I wasn't sure with the nurse practitioner what the what the exact I want to make sure I was saying the right thing.
Yes.
But
yep, you are.
But she's on here to talk to us a little bit about because the other thing that the thing that we have her on to talk about is she's the VP of the Coalition of Advanced Practice Registered Nurses in Indiana. And so she had reached out to me actually through my campaign because of her position. It's there's some legislation that you guys have been working on, and we can get more into details on that. I don't want to go too much in the weeds on that because again, that's not the point of doing this. We just want to have you on. We want to talk to you about it. It seems like one of those no-brainer issues. Again, I'm not a nurse practitioner. I'm just a wannabe libertarian politician and podcast host. So, so why don't you give me some background on the CAPNI.
Sure. Yes. So CAPNI is the Indiana state organization that is run solely by advanced practice registered nurses in the state, and we represent all of those. So that could be a nurse practitioner, it could be a clinical nurse specialist, or it could be a certified nurse midwife. Those are all considered advanced practice and under kind of the India State Board of Nursing. We consider, as nurses, we consider like nurse anesthetists as advanced practice, but they're actually under their own kind of section with the state outside of the Board of Nursing.
Okay.
Where would a physician assistant, where would they fall?
Yeah, so they're still under what Indiana considers like the Indiana Professional Licensing Agency. So they still have to be licensed and all of that, but they're not under the Board of Nursing. They're usually under the Board of Medicine for the state.
Okay.
Yeah. Yeah.
Okay. And
so a little bit different.
And so what is, I know you were talking to me a little bit about some legislation that had to do with prescription. So tell me a little bit about that.
Yes. So in the United States, all throughout the United States, any advanced practice nurse, so again, nurse midwife, clinical nurse specialist, or myself as a nurse practitioner, depending on where you live in the United States, you are considered to have either restricted practice, reduced practice, or full practice. Indiana is considered a reduced practice state. So that means that I can practice in the state of Indiana. I can assess, I can diagnose, I can treat, I can manage. But when it comes to writing a prescription for a patient, I have to have what we call a practice agreement with either a physician, a dentist, or an optometrist.
Okay.
So, and this is state law. And it varies again from each state. There's about 27, 28 states now in the United States that have what we call full practice authority, meaning I can autonomously go out, independently treat patients, prescribe for patients. But in Indiana, we are not allowed to prescribe unless I have a physician contract.
Okay. And what does that entail?
So that requires myself and a physician. Doesn't necessarily have to be geographically close to me, right? So we're in Northwest Indiana. So I could get a physician from Southern Indiana to fill, to sign this with me.
But it
They're
has
not
to be
required.
in Indiana.
But it has to be in Indiana.
Okay.
Yep. So, so we sign this. It notes what kind of location I'm going to be practicing at. So there'll be an actual physical address. And then it requires me as the practitioner, anytime and only when I prescribe a medication for a patient. So say, Travis, I see you in the office and you have a urinary tract infection. Okay. So I'm seeing you,
You
I'm
get
going to
some.
prescribe. Right.
Thanks for that one. That's the. I guess it could have been worse. It could have been erectile dysfunction. So that's
Right. No. This is a better example. So if I see you for that, I prescribe you medication. Say I then see Keith for something else, I don't prescribe medication for him. Within a
But he's Scottish.
month,
He can handle it.
right, he can
Right.
handle everything. Yes. Within a 30 days time, I have to then send 5% of my prescriptive chart. So those patients that I prescribe medicine for, but only 5%, to the physician, and it's random, to the physician to review. They then have supposedly 7 days to review. I can attest it does not always happen in 7 days. And they just have to sign off in the chart. So remember, these are retrospectively reviewed. So it's not like I'm sitting next to the physician saying, I'm seeing Travis, he has this, I'm going to give him this. No,
Okay.
I'm doing all of this independently, and then they're looking at it later. So I always use the UTI example because most of the time, if someone has a UTI, especially women, will prescribe for 3 to 5 days. So if they're not reviewing that chart until 7
7 days
days,
later, they
The
might as well
treatment's already done.
just yeah.
medications are done, right? So essentially, that's really the crux of the practice agreement that I have to go into to prescribe. Just to prescribe. I can do everything else. I can function completely independently. It's just prescribing.
And so what's the I guess what would be the devil's advocate point? Like let's say you're a doctor, put on your
Yep.
like I know you well, let's not say you're a doctor because we want to actually get things
Physician.
done. I'm just kidding. I'm just kidding.
Yeah.
What would be the benefit to the doctor
Sure.
being the
So
reviewer? I mean, what's their benefit other than possibly charging you like a fee?
sure. So I can tell you what I see the benefit and what most of your advanced practice nurses see the benefit as. And then just knowing kind of what the physician argument is. And I can start there. The physician argument is that we don't have enough education, clinical knowledge that they do, so that we need oversight. Medicine has often been looked at as a hierarchy, right? We know what hierarchies are.
Yep.
And
Yeah.
physicians place themselves at the top always because of how they feel their clinical education, knowledge, practice experience should be. So they think it's a safety issue. If they're not overseeing us, we will not be safe in our prescribing habits. Okay.
I guess my thing would be if you really believe that, then I would say that 5%, then you would be requesting a much higher level than 5% because
Sure.
and again, I'm sorry, I don't mean to interrupt, but that's just,
No.
to me, that's just the real easy answer. It sounds like you just want a little piece of the pie.
Yeah.
And
Yeah.
another
It's go ahead, Keith.
another question that I would ask, not looking at it as a doctor's point of view, but
Mhm.
if they want to be involved in patient care, why would you be? They would have to break it up regionally. I mean, there's 36,000 square miles in Indiana, and you could have a person in Evansville and a person in Cherville.
Mhm.
Yeah, and you can get a chart, but unless you're actually talking, and this more than I do. You could just looking at me and Keith, you can just assume and talk to us, but you would want to actually meet us in person and figure that out. So a doctor just looking at a chart and just going, yeah, sure, that looks good. That doesn't make any sense. So
Correct. So from my perspective, and from the majority, of course, I can only speak for myself. For a lot of your APRNs, it boils down to a couple things. Money, right? Because
everything does.
everything does, yes. And when I was working for local organizations, I didn't have to directly pay a physician to sign a contract with me, but the physicians were paid by the organization to have a contract with me. There's other, whether it's a nurse practitioner or especially like midwives in the area where there's not a lot of other opportunities or access to care around them, they're having to pay thousands to $10,000s of dollars to have a contract. And this can be per month. So, yeah. And physicians are not limited in how many nurse practitioners, for example, contracts they can have. So one physician could have 10 nurse practitioners and be signing off on charts and getting paid for each one.
Yeah, or he could have 10 and live thousands of miles away.
Well
Or
well, and
not
I guess my
thousands, we'll
next
say
question is
hundreds.
then, is with all of this being said,
Mhm.
and let me ask you, so, the state of how does the state of Indiana stack up, compared to the other states of where we stand in, quality of healthcare?
Yes. So in fact, I wanted to make sure that because we talked about some numbers, some stats the other day, Travis. I'm like,
Yeah,
I
I
want to
don't
make
remember it exactly. I remember they weren't fantastic, and
they
that's
were
why
not, but I
that was
wanted to
kinda
make
my next
sure.
question.
Yeah, because we're far enough into 26 that we should have some 25 numbers, and we do. So out of the 50 states, overall health ranking for Indiana is 37th. That's overall health. For overall mental health, we're at 42.
Oof.
Yeah. And for public health, it depends. Some will say 45 and some will say 48. So we are on the very low end of the 50 states. And again, that's for public health. But if you look at the states, like I was talking about, that have full practice authority, you can always look at the American Association of Nurse Practitioners. It's AANP. They have a map. They show all of the full practice states in green. They show the reduced practice states in yellow and then restricted in red. And then if you look, I mean, you can look up through Health and Human Services, or you can just Google it and it'll tell you the states with the best health outcomes, with the best health rankings. And every single one of those states have full practice authority for
And
advanced
that
practice
makes sense,
nurses.
because
It
if
does
you
make
have
sense.
the more, again, it all comes down to what you have the more options, right? If
Exactly.
you have more options, the better.
Well, and you have more ability to access, right? I mean,
Right.
we live in not, for the most part, not a very rural area of Indiana, but outside of Lake and parts of Porter, Marion County. I always forget what Fort Wayne's County is. And so it's very rural.
Yeah.
So, and that's how a lot of the states are. If you look at Washington and Montana, they are extraordinarily rural, but they're still having better outcomes because they have more people within those areas, whether it's physician, it's a lot of nurse practitioners
Yeah.
that they can access.
Hmm.
Yeah.
Are there any, like, for a doctor to sign on with you, is there any liability on the doctor's side?
That's interesting, right? So there has been, and not just in Indiana, there's been in other states where there's been, whether it's civil suit or something against a nurse practitioner. I mean, it happens, right? Whether it's physician or NP or nurse midwife. And no, because I have my own license, I am liable. Now, if the physician signed off on a prescription or something, and maybe I asked them to consult on a case, right? Maybe I'm like, I'm not so sure about this. Can I get a second pair of eyes? They make some notes. Sure. Then yes, they can be held liable. But if it's something that they were just, yes, I agree with the prescriptive, choice, but I'm the one that prescribed it. It's still my license. That's on me. I will lose my license
Wow.
potentially, or at least be suspended or some sort of,
Have to go through the rigmarole.
yeah,
Now
You're
exactly.
the
I'm
one
going to have
that
to go
is.
before the board. Yeah.
Yeah.
Hmm.
now, as
Yeah.
a nurse practitioner, do the doctors help you build your practice at all?
Um,
Because, I
I will
mean,
say potentially,
potentially.
yes. So I can use my example. When I first started out as a nurse practitioner in 2011, I joined an established practice. So in the beginning, I was kind of seeing the overflow of the physician. The physician was super busy. Hey, I'm going to have these people go on your schedule. The front desk would ask, hey, do you mind seeing the nurse practitioner? Sure. Okay, fine. So in the beginning, a lot of them were, yes, overflow from the physician. But as time went on, I had my own patients that never saw the physician, right? I mean, that's the nice of
Right.
that's the great thing about having choice, right? Some
Yeah.
people want to see a physician, then they should. Some people want to see a nurse practitioner, then they should be able to.
Right.
That
There were
me
some that would switch over from the physician to me because they just had a preference. It's
Yeah.
nothing against the physician. Everyone has their own
Sometimes
preference.
it's bedside manner. Sometimes
Absolutely.
it's, yeah. So
well, with
Absolutely.
me having a heart attack 4 years ago, I seen my cardiologist when I was in the emergency room. Then he came up to my room after, and I seen him in the cath lab because I was
Yep.
awake. I seen him up in the room a couple times, and now I go to the cardiologist, every 6 months? I have seen him once. I
Probably see a nurse practitioner.
No, I actually
Oh,
asked her that today.
he's a
She's
PA?
a physician assistant.
She's a PA. Good,
Ah.
good, perfect. Which is considered an advanced practice provider. It's
Yeah.
just a different learning model, really. Yeah.
Okay.
In, there's another doctor that I go to that I have God, what is it? He worked on my kidney. I
Mm,
don't remember.
Oh, you're trying to think of the
nephrologist, probably.
Yeah. I
Yep.
seen him one time. I've been in there 5 or 6 times. I've seen him once, and the rest of the time's
Yeah.
been nurse practitioner.
Yeah.
Uh-huh.
But
And it's a very common model.
in my eyes, that's how I picture it should work. Is it's the doctor's office, and you got the nurse practitioner working with him. But like you say, you can be a nurse practitioner up here in Northwest Indiana, and the doctor that is working with you lives down in Terre Haute. I mean,
Yeah. 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 That happens
Yeah.
a lot with a lot of like your minute clinics and things like that. There will not be any geographical closeness.
I'm kind of
Okay.
curious about that too. The like CVS's mini clinics, which I shouldn't even say
Hmm.
CVS, but would they
I don't think we're
con
big enough yet to start getting sued by people. Maybe down the road. Our very first episode, we had an NFL football game going on in the TV behind him the whole time, and
Oh,
afterwards, I was like, if we ever do make this
oops.
big enough, we're gonna get our asses sued off for this. So
well, I'm curious if they have those minute clinics. Is CVS contracting just one doctor to cover this region's CVS's?
well,
Yes,
Well,
one
nice.
or two. Yeah,
yeah, yeah,
absolutely. Yeah.
yeah,
And like you were saying, Keith, because you were talking about a lot of specialists, a lot more of your specialists will do that way, where they'll have like the physician and then they'll have multiple nurse practitioners. Some will go to the hospital and do rounds. Some will see just patients in the clinic so the doctor can do that. I mean, that's great because obviously the specialty is so focused. They're just
Yeah.
focusing on your kidneys
Well,
or focusing on your heart, right?
yeah.
well, when you're Scottish like me, you wait till death before you go
Yes,
see the doctor.
I gathered that by how you told me your wife drove you. Yeah,
I don't need an ambulance.
I'll be fine.
It'll be
Yeah, I'll be
fine.
fine.
Nope, it's just a pork chop.
You're right.
Like the old Chicago Bears commercial. Remember that
Yep.
guy?
That's
Oh,
yeah, yeah,
yes.
yeah. That's
Yep. You
my
got a
neighbor
Polish
across the street.
sausage.
So, yep,
Yeah.
yep.
Yep.
So I guess my next question is kind of bringing it around back to like the legislative side of it, right?
Yep.
So I know you guys have really pushed to have that changed. Is there anything else alongside that kind of goes hand in hand with that, or is that pretty much the nuts and bolts of it?
It's pretty much the nuts and bolts. There's been a lot of legislation that CAPNI has worked on over the years. This is not just an Indiana issue as
Right.
far as what we call signature authority for healthcare providers. And it is not just an Indiana issue. Multiple states have had to go through literally all of the statute and be like, oh, this says only a physician can sign this, or only a physician can order this. The most prominent example is school and sports physicals. For the longest time, nurse practitioners could not fill out those forms. And we could not sign those forms. And the interesting thing is we would see the patient, we would fill it out, and then a lot of NPs would take it to the physicians. Oh, I saw him, everything's fine, and they'd sign off on it. So we're doing the work anyway. So it just made no sense, right? And as a physician, I mean, I trust me because I'm me and I know what I do. But as a physician, if I didn't know me, I don't know that I'd want to sign off on anybody else's
Right.
work,
That was
right?
the next, like, well, it's like we said earlier, like, assuming that, let's say we're up here in Northwest Indiana and you see us and,
Yep.
the doctor's out of Terre Haute and they don't know
Hmm.
that, they don't, they just know what your notes are. That makes no
Exactly.
sense to me that you would want to
Yep.
still have that on, especially for that particular reason. But I guess that's,
Correct.
again, it's because you want to have that little last little grasp of control.
Yes.
Um,
It is very much a power and control.
So I
So, but
got
a
a
lot of
question.
those signature authority things I talked about, like with the physical forms and that, we've exhaustively gone through all of statute and said, oh, hey, the state's saying that NPs or nurse midwives can't sign off on this. Newsflash, we've been signing off on some of these things and no one's ever, they don't even realize that it's in that is. Some things they did, and we've gotten that changed. There was a time we couldn't order physical therapy for patients. We couldn't order home health. And that creates barriers for the patients, because what ends
right,
up
right.
happening is they'll see me
Yeah.
and then they need this. I can't prescribe it. And as the physician, they want to do their own exam. So now they're getting two
Right,
charges.
they're getting 2 charges, they're having to wait double the amount of times,
Mm-hmm.
especially if you're setting
Yeah,
somebody up with home health, they need it immediately.
exactly.
They need it
These are things
yesterday.
that need to be taken care of right away. So now it becomes another access barrier. Yeah.
You right before we started saying that, Keith, you were just saying
Oh,
something. We
yes.
cut you off.
Oh,
I just wanna
I
make
was
sure you didn't forget it.
I was wondering, is CAPNI, is that um considered, or do you have like a political action committee or any type of super PAC?
We do. So we haven't always had a political action committee, but we do. We do have a PAC, and because obviously of our 503 designation, we have to go about it very carefully. But it is ours. We kind of sponsor it, but we have other people that are also part of this. So we have multiple kind of arms. We have our PAC, and then we also have non-nursing organizations that support
Okay.
CAPNI specifically in our endeavors. So we call it Hoosiers for Healthcare Access. So, it's people like AARP. What's the other one? There's a dozen of them. Hang on, I will tell you.
Yeah, no rush.
Well, while you're looking at that,
Otherwise,
do the doctors have a super PAC trying to block this?
yeah. So the Indiana State Medical Association is much larger than our organization. I mean, much larger. Even though technically there are more nurses in the state of Indiana than there are physicians. But, we have our umbrella organization, which is what I mentioned, the American Association of Nurse Practitioners. There's a midwife organization, but the Indiana State Medical Association has the American Medical Association. So well
I
funded.
I've got this
Well,
this this thing in my mind of, like, a bunch of doctors out going golfing, and they're like, "Hey, yeah, Tiffany, I'm gonna need you to go ahead and send out that email for me," and she realizes it's, like,
yes.
emailed, like, that of the legislation against, what she's trying.
Um,
Oh, yeah.
I,
So we laugh all the time, because part of my role with CAPNI, I do a lot of advocacy. So I was telling Travis that there's always a day in January that a bunch of us APRNs are at the State House in our white coats. And there's usually, 100-ish of us.
I think Kathy Lynch has been there.
Probably, I'm sure.
Yeah.
And we've been doing it for, and every organization has like an advocacy day that they can do. But
Yeah, absolutely.
But throughout whatever the legislative session is, whatever the timeline is, there'll be multiple whether they're physicians or med students, in their white coats as well, really kind of speaking against any change in legislation. And my favorite part is when it's physicians, we always tell the legislators, make sure you ask, how were they able to take off to be at the State House today? Is it their day off from seeing patients? And 9 times out of 10, they'll say, no, I have a nurse practitioner seeing patients for me at the
Look,
office.
like Travis was saying, he pictures a doctor on the golf cart, saying, "Hey,
Yep.
type this up." You got a picture of the doctor on the golf cart saying to his secretary, "Hey, you need to raise what we charge that nurse practitioner because they're trying to pass a bill against us."
Right. Oh, yeah. Yeah.
You're right.
Yeah.
That's exactly it. Well, and trust me,
Yep.
I used to be not to crap all over the Republicans, even though we do it on this show every day or twice a week at least. Well, then fair, we crap all over the Democrats too, so it's okay. But we both used to be within the Republican Party, so we were on the golf course with those doctors when
Mm,
And Travis's
sure.
golf game, terrible.
no, horrible. The only thing that would make me even close to being a doctor is my penmanship. That's it.
You got that. Yeah, you'll be good.
I got the doctor's penmanship. Um, so
I
so
was, go ahead.
oh, sorry, go ahead. No, you.
No, I was trying to think some of the other organizations that popped into my head that, again, help with the PAC and help along with supporting us that are non-nursing. I said AARP. Also, I think it's Indiana Minority Health Coalition.
Okay.
They joined on. Americans for Prosperity joined on. Their kind of lead lobbyist guy is a huge advocate for us because his wife has used a lot of one of our nurse midwife services because there's no access for
Yeah.
labor and delivery, within like a 40-mile radius if it wasn't for her. And then there's some local organization, even local around here, some of the universities, colleges, things like that. I know there's several others. They'll probably come to me as we're chatting.
Well, and it's there's so many parallels between what we're talking about with this and then, everything else that's going on. It's kind of one of those like, the people they're kind of on the ground level that really put in, roll the sleeves up, get dirty.
Mhm.
I mean, it's one of those things I I'm obviously not in the in this world. But it's it's very obvious to me who it is that's really that shows up and really puts the hours in. Like Keith was saying earlier, like when he's, how many times did you see your doctor after the heart attack?
Yeah.
A handful. You always see the people on the bottom, and
Mhm.
and it's you're always kind of said like, oh well, they're not the doctors. Oh, okay,
Right.
well, I mean, what's the
Mhm.
difference between what your education is and the doctors? It's fairly minuscule, isn't it?
If you talk to us, yes. If you talk to the
Yeah.
physicians, no.
Yeah.
But I mean, I think I understand in a lot of ways where the physicians come from when they're like, "Well, we went through all this schooling." Yes, yes, you did, and I'm sorry that you had to do that. You guys need to reevaluate your educational model,
No, I'm just
right?
joking.
I mean, because they come out with so much debt. I mean, that's
Yeah,
why a lot of physicians go into specialty because they can pay it back quicker. I
yeah,
totally understand that. But you figure for a physician, they're going to their 4 years of just, get their bachelor's,
yep,
get into
undergraduate.
medical school, right? And then, I mean, they do have a long time. They have their residencies, all of that. They don't pick their scope of like practice, what they want to do. So, like Keith, your cardiologist, they went through all these years, 6 to 8 years, and then they say, oh, I want to be a cardiologist. And then they do, more learning, a lot of clinical hands on specific for cardiology, take an exam. So, I mean, as a nurse, right, I did my 4 years for my bachelor's, which was very general. It's just general nursing. It's not like I said, I want to go be a labor and delivery nurse. No, it was just, you're going to be a nurse and then you'll land the job that interests you, whether it's ICU or emergency room, maybe labor and delivery. So then, I'm working all these years as a nurse at the bedside, right? Being with patients, caring for them for anywhere from 8 to 12 hours. And then I decide, I do want to be a nurse practitioner, but I pick my scope. So at that moment, I say, I want to be a family nurse practitioner, or I want to be a emergency room nurse practitioner, or I want to be a pediatric nurse practitioner. So when I'm in school for depending on the end result of that degree, anywhere from 3 to 5 to 6 years, 3 to 5 years, I'm just learning that scope. I'm not, learning.
Not as broad.
Right. Now, of course, I'm family practice, so mine is very broad because, we learn the lifespan.
Right.
We always say we learn womb to tomb. So we're learning a little bit of everything. But we're also, practicing as nurses long before we're even in school learning these things.
Yeah.
So we bring a lot of the knowledge that we already have into it.
Didn't you mention that you have a doctorate?
I do. Yeah. So there's 2 different, essentially, doctorates for nursing. You can get your PhD in nursing. That's very research focused. God bless the people who want to sit and do the research. Not for me, but we need them. And then my doctorate is a doctorate of nursing practice. So essentially, I'm the implementer. I take all that research and I say, hey, this might work with this population or with these patients with diabetes. Let me implement this and make sure that we're getting the evidence-based research to the people who need it, to the patients. So it's more hands-on care.
You're the physical side of ChatGPT.
Yes, I am. Yes. Yes. Yeah. When you Google, if you're in ChatGPT, think of me at the bedside or at the clinic doing things with patients. Yes. Yeah. And that, the goal with that for nursing was to make sure that the researchers are researching, handing it down to us in the clinics with the patients. Hey, this is working. Hey, it's not working. Why don't we try to look at it this way? Make it more real world for patients and for it to actually improve care. So where your physicians, they're getting their MD. I mean, they are doctors. We're all doctors. As I always say, like your doctorate is not dependent on you being a physician. Your doctorate is all based on your education. They're just medical doctors. I'm a doctor of nursing practice. Just like a dentist.
So you are Dr. Jodi Allen.
I am.
But then I was like, oh shoot, I don't want to say it and sound like an idiot. And I'm like, man,
no, you're fine.
And of course, I didn't have your initial email with all your titles up, so that's why I was like,
that's okay.
No, shoot, I had a bunch of
well,
other
and
names, but of course,
it's interesting in the state of Indiana. You have to be careful with that too. So because again, physicians have cornered the market on the term doctor. So I can tell people that yes, I'm Dr. Allen, or I usually just say Dr. Jodi. I'm a nurse practitioner. I have to make sure that I'm very explicit that I'm a nurse practitioner. And I get it. Physicians have been noted as doctors for a long time. So I wouldn't want someone to assume that I was a physician because I'm not. Not because I feel, like they would be calling me a bad name. There's nothing wrong with being a physician. It's just, that's not what I am.
Like when I tell people I'm running for office, but I'm not a politician.
Right.
Let's get this straight.
Right.
Look, it's not the same thing. It really isn't. Okay.
Right.
So do you feel like this bill's gaining any traction with anybody?
Well, yes and no. So we've kind of been pushing this since around 2018. 2019 was probably our best year. We really had a lot
COVID
of
leverage, I'm sure.
Well, not quite. Well,
or not so much.
That's another story.
I was like, debating, like, I won't even say the C word during this. Like,
I know. Okay. I know. It's very, in healthcare, it's almost like AD and BC. It's like COVID, pre-COVID, post-COVID.
It is Tuesday. See you next Tuesday.
Oh, whoa, man, you're going there. See, well, great. Now we're definitely we're gonna get shadow banned. We can't put this on YouTube. All right.
You said the
Can't
C
click
word,
the little
Travis.
button that says this is for kids. He usually gives me crap because I I'm trying not to. I sometimes on the podcast have a tendency, especially if we're like getting into politics, and I'll be like, and another
Yeah.
effing thing, and I start dropping f
Yeah.
bombs, and so I
Yeah.
try. I'm trying
Just
not to though.
censor
I'm trying to be
yourself.
really good.
Yeah.
Don't push me, Keith. Come on.
I'm just using acronyms.
Yeah.
That's funny. So yes, to answer your question, Keith, yes, in 2019 we had really good traction, bipartisan support, but it's really been a lot of a grassroots efforts. All of us in CAPNI, we speak regularly with our legislators, hence why I got into contact with Travis, and really I just like to make sure that even no matter what happens, even if something doesn't happen where you get into office, you have much more information just as a constituent.
Right.
So we really
Well,
try
that's
to get
why
it
I
out there.
told you
So
too, full disclosure, that's why I told you at the end of the conversation, I
yeah,
said, definitely I know you've tried to reach out to Soliday a bunch, and we're gonna get to that.
yeah,
But I reach out to Ryan
Palmanakis.
Kalmanakis. Definitely
yeah,
reach out to him.
yeah,
Because the more people that you can get on there,
yeah.
this I don't necessarily want to be like, no, don't say anything. I'm gonna corner the market on that. No,
Right,
absolutely. Try.
right. Yeah, the
I'm gonna
more the
share it.
Yeah.
merrier with
Sounds like
this.
Exactly.
Dr. Travis.
Oh.
Yeah, we had a really good push in 2019, and that's kind of where some of the challenges began. Senator Charbonneau, out of Valpo here, he's been really great about authoring our bill for the Senate, and he's the chair of the Health Committee in the Senate. So
Okay.
it passed through the Senate in 2019. And then it went to the House side, and the chair of the Health Committee at the House side is a retired physician.
Ah,
Oh,
that never helped.
Yeah. So they won't even hear our bill. Won't even hear
Killed
it.
it, huh?
Kills
Killed it
it. Yep.
immediately.
Yep.
Dead on arrival.
Yep. Won't even though there's, we have usually a separate bill, Senate and House, the mirrored bills, and we'll have multiple bipartisan support on the House bill. Won't hear it. So we've gone to the speaker, we've gone to the governor.
I'm sure that
And
didn't go anywhere.
yeah.
Not to say too much about Braun, but
Yeah.
I'm not the biggest fan in the world.
So it's been
If you show
challenging
up to the
because
governor's house, you gotta bring a checkbook with you if you wanna have anything to be seen.
we had really good and we've had really good support from, and it's not just in this area, not Northwest Indiana. It's been Senator Good. He authored our bill out of nowhere. He never even consulted us. He just saw it, knew that
That's
it
cool.
needed to be a bill, and just put it out there. We were like, oh, someone likes us, someone who actually can see reason here. We have one APRN on the legislation. She's a representative, Cindy Ledbetter. So she's always really trying to push for, she's a nurse practitioner herself. So,
Okay.
trying to get this passed. But, there's other physicians or spouses of physicians that are in both the House and the Senate that are very adamant about this not going through. And that's just not great, because
Well,
really it comes down to, this is not about us. It's not about nurse practitioners. It's not about physicians. It's about patients, and it's about Hoosiers that are not able to get access. And my pet peeve, remember I talked about the hierarchy, and physicians are always at the top of that hierarchy. If you ask not just physicians, a lot of healthcare providers, we're very adamant. I think I sent it to you, both of you actually, because I know you shared with Keith.
Yeah.
We look at kind of the healthcare model as it should be a circle. And
Yes.
the patient
Hold
should
on.
be in the
I can do this.
center of the
Hold on.
circle.
For
And
all
then
those
we're,
of you that don't, hold on one second.
oh, you're good.
I'm gonna share it on the screen.
Oh, perfect. Great.
I had it up in my notes. All right, so we can share it on the screen.
There it is. Yes. Yeah. So a big thing really in healthcare, this is not just a nursing thing, but it was kind of pushed a little bit more with nurses, is that patient-centered or person-centered care. It should always be about the patient. So instead of having that triangle hierarchy, we look at the patient as being in the center. And then there's all sorts of providers that that patient is probably going to need to see. Are they going to need to see a physician? Maybe. I'm a family nurse practitioner. If they need a cardiologist, I'm not the one. I'm going to refer them to a cardiologist. If they need to
Right.
see a neurologist, I can only do so much for so many things. It's out of my scope. They need to see a neurologist, but they might also need to talk to a pharmacist about their medication, or they might need to talk to a social worker if there's social barriers for them getting to their optimal health.
Yeah.
So that's kind of how we look at it. But as much as important as I think this is, and it really is team-based care, and physicians will talk about team-based care. They always say that they should be the leaders of the team. And again, the patient really should be the leader of that team. It's about the patient, right? The patient is
Right.
having the issue. Okay, yes, you need someone who has the knowledge to guide the patient, but the patient should be the focal point.
Well,
So
and I can imagine, and I don't know this. I don't. I this is just on the top of my head, but I can imagine that the more people that you see, the more times your insurance provider is being billed, and the more my bill's going to go up because these guys don't want to release the reins on something. Listen.
sure.
I take a couple of monthly pills every day.
Hmm.
I'm so he's Scottish. I'm German, so I've had high cholesterol since I was 30.
Oh boy.
So I've been on cholesterol meds since I was 30.
Since you were
Yeah.
13?
13, basically, yeah.
Oh
Like, I
gosh.
would take my cholesterol med, and then I'd put in my chew, the Pennsylvania Dutch. That's what we would start off with, right?
Oh my
Um,
gosh.
so yeah, we're blue, we're blue collar
Yep.
Chicagoland area guys,
Yep.
so,
Yep.
but my point is that when I like, and if I don't have to see a doctor, hey, listen, I need to refill my prescription. Well, it's every third prescription refill, I gotta talk to a doctor. And I'm like,
Hmm.
why? I turned 40 in a month. I have been on cholesterol meds for 10 years. They're
Yeah.
working. They're doing a good job. It's all
Yeah.
fine. I
Yeah.
appreciate it.
Yeah.
Um,
Hmm.
but what do I need to what am I doing here? This doesn't make any sense. Why am I doing it every 3 Because somewhere that's the rules. And I don't know
Yeah.
if, and that's fine, I guess. I mean, it's whatever, but
Yeah.
it shouldn't be, you know, we all get nickeled and dimed so much anyways. Healthcare costs are some of the highest in the US comparatively.
Yep.
Um, I mean, this just seems like, and again, even if this is only a drop in the bucket, man, it's the first drop, right?
Exactly. Well, yeah, because it comes down to, you know, if you lived in a more rural area, Travis, and you weren't, if you had to drive 50 miles to get
Yeah,
to see someone to get your cholesterol medicine, you're not going to get your cholesterol medicine
right.
because if you're working, I mean, this is life. We're going to work so that we have money, so we can pay for a house, so we can
So we
get
can pay for
food,
cholesterol
right?
medicine.
Right, exactly. And the
So
cholesterol
we can
medicine, when you start having those barriers, it ticks down on the priority list. But if you had someone who, hey, I just have to drive 10 minutes to go see somebody, and a lot of times that somebody in the rural areas or even the super urban areas is a nurse practitioner or
Yeah.
a nurse midwife. So, and then like you're saying, the nickel and diming, if you, okay, well, as an NP, I can do some things for you, but oh, wait, the physician wants to see you to do this.
Mm. So you
Now
still
there's
gotta drive,
more
and especially now, I filled
charges.
up on gas today. I saw an article from the new not to change the subject because I really don't want to, but I
No,
saw an
you're good.
article on the, Northwest Indiana Times that said that supposedly gas went back down. Did you see this? Like, the Northwest Indiana Times said that the gas went back down, like, 75 cents or $1.12. So it was some arbitrary number. I filled up for 4.41 today. And I'm
Yeah.
like, where's this imaginary number that you guys came that was reported? So regardless, and
Yeah.
if you're on a fixed income and you're
Yep.
elderly, and
Yep.
I turn 40 next month or 2 months. I'm like, I gotta take every month. So I got 2 more months in my 30s. So I'll take them. But I got 2 more months in my 30s. But, there's, my father's on cancer treatment.
Yeah.
He's got a whole host of pills and things
Mm-hmm.
that and of course, luckily we're in the Northwest Indiana area, so
Yep.
everything's fairly
Yep.
close. But
Yep.
like you said, God forbid you're out in the sticks.
Yep.
What do you do?
Yep. And unfortunately, I mean, we need physicians out there. I'm not saying we don't need physicians out there. We do. They're just not really going to those areas. So a lot of times it's your
They gotta pay their bills. They gotta pay off
friendly
the
neighborhood.
loans,
Right. You got to pay their
like,
loans. Exactly. So it
But
becomes your friendly neighborhood nurse practitioner that
yeah.
is
I didn't
there.
read the bill that you're trying to get passed, but is it like a blanket bill to eliminate the stranglehold that the doctors have you in?
Yeah, it essentially removes, and this has been essentially the bill we've been putting out each legislative session for quite some time. It essentially just completely removes that requirement to have a practice agreement, to have them review the 5% of charts. It doesn't change our scope of practice. It doesn't change, how we're going to refer as needed, right? I remember I said I can't do everything. I can do a lot
Right,
of
right.
things, but I can't do everything. There's some things
Uh,
that are just not my specialty. They're going to be referred. So it doesn't change that. It literally just removes that requirement and that requirement to have, a physician, quote unquote, overseeing those prescriptive charts. It removes that. So that
Yeah.
provides us then to be able just to
have you thought
prescribe as
about
we've been educated, trained, and licensed to do.
how many years have you been trying to get this bill passed?
Since about
Well,
2017,
Yeah,
2018.
yeah, 2017, I think
so
was what she said.
have you
Yeah.
ever thought about, instead of trying to do it as like a blanket bill, basically cutting it out and piecing it together? Like, if not the bill that you have, but if you
Mhm.
could put pass a small piece of legislation, not even eliminating the doctors from being your overseer, but limiting what they can charge you to be your overseer. Like, how you said,
Ah.
they can charge
I get you.
Mhm.
$100 to 10 grand. What if
Yeah.
they limit it to I don't know, $1,000 a month, or whatever's reasonable to you. I
Mhm.
think once if you did it like that
Kinda foot in the door
piecemeal,
idea.
if you did it like
Yeah.
that, piecemeal, once you start eliminating the value of it, basically.
Mm. It's an interesting
And
thought. Yeah.
and that's
They
one way to
wouldn't be
look
as
at it.
keen.
But here's the only thing I'll give some pushback is that they've already got it passed in the Senate. So all you
Yeah.
need is the House. You know what I mean? Like,
Yeah.
that would be the only thing. I get what you're saying, and it's almost kind of like a once you get a foot in the door, but,
Mhm.
yeah, I mean, you've already got one half of you know what I'm saying, though, Keith?
Yeah.
Yeah,
Like,
I
that would
do,
be the
but
only
I
oh, sorry,
don't,
I didn't mean to
because
burp into the mic, I'm sorry.
while you look at it as you have, say, one foot in the door and one that's out, on the other side, on the House side of things, you don't even have a toe in the door, because you
That's
you
true.
you can't even get it in committee. Now,
That's
if you
fair.
took a bill that said, "Hey, I want to limit what the physicians can charge the nurse practitioners," then if you think of that committee, that you said that committee was ran by a physician,
Mhm.
the
Yeah.
people that are not on there would, if I was on there, I'd say, "Well, why don't we look at this? They're just limiting how much you can screw them over, basically."
Right. You
I
probably
think
wouldn't
it
want that to be heard either, but
well, I mean,
Probably.
it
But at least then
behind
you could say
behind closed
and
doors, we talk totally different. But,
yeah. But
I
what
think that would be a
but then
way.
at that point, then you could say, like, you could go to those guys, like what he's saying, and you could say, "Well, hey, no, hey, come on, we're working towards you. We're coming
yeah.
in your direction."
Yeah.
I get what you're saying. Yeah, yeah.
And if
It's
if you just chop away at it one piece at a time, eventually the physicians are gonna say, it's not even worth, you know,
and that's
being the overseer. It's not worth it anymore.
and see, and that's marketing. That's the game. I appreciate that, and we can talk, we can talk inside baseball all day long. But man, it still just makes me I mean, this is one of the reasons I got involved in this, is it makes me
Mhm.
so mad that you had
Yeah.
that something so small, 5%, man. 5%. That's
Well,
what you
now,
have to so
5%.
you can't even get these old stodgy suits to sit down and listen to a
Yeah.
5% difference? You know what
Yeah.
I mean, man? Like,
and I
that's the
Well,
thing that makes me so mad about government.
yeah.
That's what makes me so mad, is that you can but by God, we're well, what time is it? It's 8 o'clock. So have we nuked Iran yet? It's Tuesday night.
Yeah.
Like we got all the money in the world to do that,
Yeah.
but we can't sit down and talk about
Yeah.
like that's the thing that just drives me
Yeah.
insane.
Well, and especially because, really we're not doing this for us. We're able to do all of these things because of our education, licensure, and training, right? We're able to do all of that. Our certification, I'm board certified, so I can do all of that. But it's ultimately for the patient.
Yeah.
So
Right.
when we, try to say, hey, we're a no cost option, right? We're 37th in overall health ranking. If you don't have these really outdated rules, is what they are, on nurse practitioners, on midwives, and we can go out and we can provide the care that we need, you have a no cost option. You're not, trying to bring more providers into Indiana. You're not trying to entice people. We are already here doing the work.
Yeah.
We just can't do it to the full extent of what we should be doing.
And
And I think
I
that's where
think
we get frustrated.
if you
Yeah.
wanted to change like we'll call it the scope of work of nurse practitioners when it comes to the state house, I think that would be much easier to change if you did it piecemeal, one line at a time. When as a as a voter and as a constituent, instead of looking at this as a politician, I hate when they throw this bill out in front of me and they say, you got to pass the bill to see what's in it. And it's 3,000
Oh,
pages long. Why?
yeah.
Why do why do they think it's okay to pass a farm bill that the farm bill also has welfare in it, food stamps in it? There should be a
Yep.
food stamp bill, a welfare bill, a
Yep.
farmer
Yep.
bill.
Yep.
You
Yep.
know,
Yep.
You get paid to go in there and make decisions, not don't but they all want to throw it into one bill and they just make it easier. Well,
And there
and
should
it
be
makes it so that you can't see what's in
transparency.
it.
Yes, there
Transparency.
should be
There you go.
transparency. And when we put forth our bills, they are an APRN bill. I mean, it's not like you probably noticed they always have these Health Matters bills, and it will have so much stuff in there. Where ours is strictly just an APRN bill, and it's just to revoke that contract, essentially.
Yes. So maybe the other strategy is maybe they should try to slide it into a bill.
yeah, you can do it that way too.
Yeah, there
They
has been some
try to
talk
put it in
of
there.
that. But of course this session there was a lot of other focus. But I remembered you said something about we were talking about COVID, that C word.
Oh yeah. Yeah, let's talk
Yeah.
COVID. Why not?
So during COVID, because we were in a healthcare emergency, Governor Holcomb revoked. That was in part of that healthcare emergency executive order. One of the things that was revoked was like our location. So say I was practicing in an office, because remember this was for anybody who can go anywhere to help, please go is what it was.
Right,
And
right.
that's part of that contract is I will only practice at this location only. And they revoked that. They revoked, they're like, if you don't have a contract, because physicians were dying. Physicians that we had contracts with were dying. So then we couldn't practice because we didn't have a contract in place.
Wow.
So
Nuts.
he's like, nope, we're revoking this. So for 2 years, it was revoked. Do you think the sky fell? Do you think
Right,
anything happened?
right.
Nothing.
That's the
Nothing.
I used to say the same thing, or around the same thing with COVID time, was you notice they had all these really strict things, and again, it's apples and oranges, obviously.
Yeah.
But you would go into places and you could buy a to-go margarita from the bar, and I was like, won't
Yeah.
I have an open container in my car? And they go, oh no, it's fine because we have this special thing. And I'm like, so you guys really weren't worried about it before. You just wanted to,
It was money.
it was the money. It was the lobbyists. And that's
Yeah.
when you
Yeah.
find out when you have a
Yeah.
situational emergency, that's when you find out what's really important. I'm not
Yeah.
going to lie. For a while, I was essential. So I was in the transportation industry during COVID.
Oh, yeah.
So I was essential for a minute, but we were heavy haul transportation. So we hauled like big rig stuff. Very quickly that dried up because nobody was doing any jobs.
Sure.
So I was a what do they call essential worker. I was an essential
Mhm.
worker for a little while. Keith, I know you were,
Oh yeah.
Keith the Teamster.
Oh,
Um,
yeah.
and so until I got given the option, my boss pulled me into the office and he's like, "Hey, listen, we're really out of jobs. We're gonna offer you the COVID layoff stuff.
Mm.
Or," and he tried to sell it to me as like this really great. He's like, "Or we can bump up your commission to like 50%." And I'm like, buddy, I haven't ran a load in 3 weeks. Nobody's moving any heavy
Yeah,
equipment.
everything was shut
50% of
down, yeah.
0 is still 0. I'll take the
Yep,
COVID
strong
layoff.
0. Yeah,
And
yeah.
and he was super like, ugh, like appalled that I would take the COVID layoff. And I'm like, "Dude, I gotta feed my family. Like, what are you
Yeah.
talking about here?" And
Yeah.
and
Yeah.
and I'll tell you what, the COVID I went kayaking every day. I didn't
Sounds
see
lovely.
anybody.
I did not.
It was actually very yeah, your life
I
was a
was
living hell.
working.
I
Yeah, it
was
was
I
me.
was out I was living in the seasons at the time, so I was, like,
Yeah.
floating around in the lakes of Four
Uh,
Seasons drinking tall boys.
sounds
COVID was
lovely.
I was like, "This is perfect. Let's just the sky can fall all over, it's fine."
Yeah.
Um,
Yeah.
but yeah, that was, but that's the thing, like, you get all of these, all of these little laws and little rules and everything else
Yeah.
that they put in there, and so, yeah, listen, I absolutely anything I can do, I'm going to one of the things I'm gonna do this week is on my campaign website. I'm gonna put some of this information, I'm gonna clip it together, I'm gonna put
Okay.
it on there, make it a part
Maybe
of
you
my
could just
campaign.
link it.
I'll put
Link.
some links on there too. Well, I got so she sent over in the thing. I don't know if you got a chance to look at it, but there's some good like paperwork or not
Yeah.
paperwork, marketing. There's some
Yeah.
good marketing stuff in here. So I'm gonna copy and paste some of it, put it on my website, travisgearhart.com.
Okay.
I got it. In fact, the only reason I haven't done it yet is I'm waiting tomorrow morning. I actually go in and officially open my campaign.
Oh.
What do you call it? Bank account. So I can officially start
Oh.
taking donations tomorrow. I
That's
don't have a
exciting.
primary, so that hasn't been super, the libertarians, they they do it through a caucus, and I got caucused in, or a convention rather, I'm sorry.
Okay.
Like it's the same thing. But, I got caucused in 2 weeks ago for that, so the Democrats and Republicans are all still sitting there kinda going like this until May. I've got a little bit extra time, but I can still
Okay.
start officially collecting money for the campaign tomorrow.
Okay. That's
So I've been
exciting.
waiting to do that. So once you know how it is, once you go to start working on a website, I'm not exactly a graphic designer, so
Yeah.
I'm gonna have to like fiddle, through the whole
Yeah.
dang thing. But
Oh.
now when we were talking, there was one other thing that you had brought up. Because
Mm.
I know we're coming on 57 minutes, so I know we're coming towards the end of the I mean we don't have a timetable, so we're easy.
Sure. Yeah.
But we don't want to keep you all night either.
Sure.
I know there was something that you had said, that if Lake and Porter County would have moved on, they would have like what was that grant you were talking about? That
Oh,
Yeah, tell me about
yes.
that because I don't remember
Yeah.
what it was. It's in here, but it's not.
Yeah. So the Rural Health Transformation Program, so it's that
Rural
federal program, right? Because all the
Okay.
states Medicaid kind of rural hospital funding was cut. So then the current administration said we're going to do this rural health transformation project or program, and all 50 states can apply for money from this program. And there's billions of dollars on the table. And each state had to, essentially request in a very specific way what they wanted. And then whomever that is over this program had a rubric. So do they meet this? Do they meet this? Do they meet this? Do they meet this? Yes. If they meet everything, then they can get whatever the maximum amount of money is deemed for the state. Some of it depended on population size, all that. So Indiana submitted their request, their report. And one of the things on the federal rubric was, do you have full practice authority for your advanced practice nurses in the state? If you do, or if you are, all you had to say is, we don't have it yet, but we're planning on implementing legislation within the next year, you received extra money. So
And Indiana
Indi-
said no.
They left
Indiana,
money on the table.
they left
The
lots,
most
a
fiscally red state in the
lot.
union.
Yeah, they left a lot of money on the table. And, our CAPNI organization, the legislators know us well. Some love us, some do not. We talked to them about this, and some were go, yeah, you're gung ho. You got to be on there. This has to happen. But then they didn't even invite any, APRNs to the table to actually talk about this. Like, hey, you can get tens of more millions of dollars. All you have to do is put this forth. So yet again, the patients, Hoosier patients, are going to be paying the price, because then what if a rural hospital doesn't stay open? What if a rural labor and delivery clinic doesn't stay open? What if an
Yeah,
urban, what if it's something with a nonprofit that's there and they don't have the extra funding? I work
yeah,
for a nonprofit in Gary, so I'm seeing, I think I told you, Travis, I see
yeah,
homeless or recently housed individuals, and I can't prescribe for them because I basically do it on behalf of the other organization that I work for, and then also volunteering because these people need healthcare.
yeah.
So because I can't prescribe when they're living in a sheltered environment and I can't prescribe an antibiotic for them, it makes no sense. They're going to go to the
Well, and
emergency room.
that's the region that we work in, or though that
Yeah.
work in, I'm
Yep.
sorry, that we live in. I
Live
mean,
in.
some work
Mm-hmm.
in as well. That's there. That's not going away. You're not gonna
Yeah.
pack them all up into a big trailer and ship them to California. That's
Nope.
just not. Can you? No, I'm just kidding. We can't do that. But
Some
but
states can.
yeah, some states do. Actually, Texas did that. Texas
Mm-hmm.
shipped people all over the U.S.
Yeah.
But that's neither here. That's not the point. But like we were talking when you had brought that aspect up to me, and I was like, well, that's asinine because
Mm-hmm.
think about it. And again, I'm not telling you anything you don't know, but so all right, you got a homeless guy on the street, and you have the ability to take care of him, to get him in a form of health that he's not in a danger to either
Mm-hmm.
himself or the
Yeah.
community. Now, if he walks into a hospital because he's sick and or dying or
Mm-hmm.
runned over or drug overdose, pick your
Mm-hmm.
poison,
Yep.
and the hospital has to treat him,
Yep.
right? They can't just roll him out on the street and
Correct.
say, "Good luck,
Mm-hmm.
buddy." That's the law,
Yep.
and it's the Hippocratic Oath,
Mm-hmm.
right?
Yep.
So, but then that's who again is what we were talking about earlier is affecting our insurance, affecting our
Correct.
costs. So
Taxes.
your taxes,
Mm-hmm.
precisely. It's
Yeah.
just that's just one of those things where you're looking at it on the front end and it's so short-sighted
Yeah.
and like, come
Yeah.
on, like, if you're gonna do something, let's do it on the front end, let's take care of it on the back end,
Yeah.
like, it just seems like so many of these organizations, and it doesn't matter if it's this or political ones or anything like that. It just feels like so much of it is so top heavy
Yeah.
and it's so top heavy and it's so and look, I like money and I like capitalism. I'm no pinko commie over here, But with that being said, like part of capitalism is that if you're supposed to fail, you're supposed to fail, right? So
Mm-hmm.
you take everything like and you pump all this money into it. So I I don't know. I
Yeah.
don't know. It's just
Well, and people should be, given a equitable opportunity to fail, right? So
exactly, exactly,
if they try, it doesn't work out, well, hey, or if they just don't take the opportunity, the population that I work with, a lot of them are just haven't had the opportunities. And I always say with homelessness, it knows no socioeconomic divide,
right,
right? Because
right.
sometimes, look at the layoffs, right? Sometimes
Yeah,
you have a
yeah.
situation through no fault of your own, and that can not end well, right? You can end up in an unhoused situation. So,
Oh, there have been plenty of times in my life where I've been laid off
mhm.
and, thank God I had a safety net, or if I didn't
Yeah,
have a safety net,
exactly.
I could have been, I
Yep.
couch surfed in my
Mhm.
early 20s and,
Yeah.
yeah,
Th-
that's
That brings up a whole
Yeah.
nother topic, though. I mean, we can
It
go in and
does. Yeah.
start talking about things that need to be passed about interest rates if you'd like. I'll talk about
Yeah,
interest.
right.
we can go interest rates. There's so many different
Yeah.
aspects and little things
Yeah.
we can go into, but, um Yeah. Well,
Yeah.
we're
I mean,
at
this
a
topic is obviously just, I think about it 'cause for me, the APRN stuff, it just seems so easy to me. And I know I live this and I breathe it. I talk about it all the time, but I'm like, am I losing my mind? Like, is this difficult? Should it be this difficult? I don't think so.
there's so
But
many things like that though, where you see something like that that's so simple, and then you take a step back, and I like, all right, well, hold on, let me try to take the
yeah, try to
5,000
be
foot view.
objective. Yep.
And I try to sit back, and I'm like, no, no, this is still just
Yeah.
easy. This is a no brainer, and that's
Yeah.
what, again, not without turning into a whole political
Mm,
diatribe. That's the whole point of it, though, man. Like you're
yeah.
supposed to. The easy stuff's supposed to be easy. There's
Yeah.
plenty of
Should
hard
be.
stuff, but it's so much of it is just run by
There's
money and
enough hard
special
stuff.
interests.
Yeah. Yeah.
I think that's the thing right there that you need to take back to your board. You need to look at it at a different angle. Trying to pass it as a blanket, I don't think you're going to get it through because you're obviously lacking funding, and I'm not trying to knock you on that, but you're
Oh
going up
no.
against big
We-
big time
Big
donors.
medicine. Yep.
Yep.
Yeah.
Yeah.
And you're lacking funding, and in my eyes, when you come at it with just a blanket legislation, you also lose leverage. So
Hmm.
you need to either gain funding or you need to gain leverage. And in my opinion, the one way you're not going to gain funding, you're not gonna beat them out. In order
Yeah.
to gain the leverage, you're going to have to take your bill and break it down in sections. Let's try to get this piece passed, even if it's
Yeah.
one sentence. Let's get that passed. Oh, it's passed. Okay, next year we're going to work on this one.
The other
Yeah.
side of that is once these next elections comes, I mean, I don't think Indiana is going to turn blue anytime soon, but it can definitely turn a lighter shade of red, and I definitely think that's going to
Yeah.
happen this time around. Hopefully,
Yeah.
hopefully we had some yellow in there as well.
That would
Obviously,
be
um,
great. And we do have some legislators that are retiring, and that could work in our favor. So,
yeah, yeah.
Yep.
So, well, obviously we are going to post this up. We usually post up these ones. Well, this will be up tomorrow.
okay.
I will definitely send it over. I'll add you on Facebook. You have Facebook?
I am not.
No Facebook?
I
Okay.
know it's weird. I got off during
All right.
COVID. I couldn't handle it.
Honestly, the only reason I have Facebook, honestly, I've wanted to cancel Facebook so many times. The only reason I haven't is because my Spotify is hooked up to it, and
Oh,
I have like 7 million Spotify songs. I've been on Spotify for
yeah.
20 years now or something. So
It's
if
easier
I
to keep Facebook.
it is. So, and then I do have some family. Like I have family in
Yeah.
Pennsylvania, family in
Yeah.
Western Illinois. So it's like, yeah, it's fine. And now we're doing all this stuff in the campaign. So
Yeah.
now
Yeah. You should
I'm
keep it
tied
now.
to it. So
Yeah.
I have to now. But
Yeah.
well, I'll send you an email with the link and all that.
That's fine.
Definitely, please feel free to
Oh,
share it.
perfect.
We're gonna share
Okay.
this all over. I'm gonna send it all over everybody. I'm gonna make this a part of my campaign.
I
One of my
appreciate it.
main campaign points. But again, it's such an easy one. So, I implore you to reach out to the Democratic candidate.
Yep.
I don't want to, I want this to get as much traction as possible.
Yeah.
And
That's the
thank you so
goal.
much for coming on, Jody. If we get any sort of,
Yeah,
if we
thank
get
you.
traction or there's something else going on, give us a shout. We'll have you come back
Okay.
on. And maybe I'll run into, I'm gonna be out on the picket lines doing some picketing. So maybe
I'm sure you'll see
I'll run
Dan
into your
at some
yeah,
point. Yeah.
I'll run into your old
Yeah.
man.
Yeah. Perfect. Yeah, I appreciate it. If something pops up, other like healthcare stuff, you're like, I don't know what this is. I always offer it to all
Yeah,
the
that'd be
legislators
great.
I
We
talk to. Feel free to reach out if you have like, I don't understand this or what is this or do I care about this? Feel free to
We
reach
would
out.
love to have a regular healthcare guest person, and especially it doesn't sound like you're too worried about talking about COVID. We can get down that rabbit hole a little bit. I know talking about COVID's like talking about everyone's like, no, please, it's 2026.
I
We've
know.
made it through it. It's all done. Please stop.
Doesn't seem like it was all that long ago to me, but yeah, it was a time. A
Yeah.
time was had.
Yep. Well, I think it was a pretty good show. It was very
I think so too.
interesting. I had fun talking with you.
Super informative.
Great.
Yeah, yeah,
Thank you. Yeah,
yeah.
thanks
Well,
for chatting about it. Some people are like, that just sounds boring. That's not. I mean, if you care about your health or the health of your neighbor, your family, and they live in Indiana, it's important one way or the other.
well, that's why we started this show is because so I would call Keith during the day because I'm in sales and he
Oh,
drives,
that's right.
for a
Yeah.
living. And so there would be periods of time where I would just call him and be like, "Hey, have you seen this? Have you seen that?" And we both, him and I, were involved in politics back in the day. So
Yeah.
so we'd kind of bounce stuff off each other. And that was really what got us in wanting to do this. Actually, this was Keith's idea. Keith was like,
Good
we should
job,
do a
Keith.
podcast. And I'm like, what? And he goes, yeah, just these conversations.
Yeah.
And literally this is it. What we're doing right here is what we would do, like our
Actually,
regular.
this is my favorite part of the show is when we're interviewing people, honestly.
Same.
Mhm.
Same. Well, because you're learning something new.
You are learning. Yeah. Yeah.
Like
And they're
like
people that
we've had.
usually live in your area.
Right,
Yeah.
right. Like
Yeah.
we had a congressional candidate out of Detroit on a show. We
Oh,
had
that's
a
fun.
libertarian Ohio governor
Oh, I remember you said that. Okay.
candidate. We've had some we had the I don't know if I think I might have told you on the phone. In Northwest Indiana has the number one cornhole
Oh, Yeah,
player
I had no
in the
clue. So I
in the
learned
entire
something.
U.S. We
Yeah,
had
no
him
clue.
on the show, Mark Richards. He was awesome. We had a good time talking to him.
That's fun.
Just everything across the board. It's just
Yeah.
it's fun and it's something to do on a it's 8 o'clock at night on a Tuesday night. What else am I going to be
Yeah.
doing? Watching TV? I'd
Well, if you
rather
ever
be
want to
doing that.
have a discussion about the Chicago Bears, that's my other passion.
There we go.
Oh,
There's
really?
your man. There's your man.
Yeah.
It should have been the
Diehard.
Portage Bears. Should have been the
Ah,
Portage Bears. I don't
I
think the Hammond one's going to work out.
I think
What do
they're
you?
just. I think they're flirting with Indiana. They're just trying to get more out of Arlington.
Yep,
Yep,
That's what I think.
that's all.
exactly.
That's you're on our page. That's it. And
Yeah.
here's my thing. I don't want them to raise the taxes for it. I
Yeah,
think
because
that's
it
crap.
sounds like they won't, but come on, they're going to
Well,
raise
Well,
it.
no, they're going to. They're going
only
to.
if they raise the
The
taxes
bill. What's
in
that? I'm sorry,
Lake.
Keith?
If they raise the taxes in Lake and Porter County, I'm fine with it.
Oh, are you not in Are you not in either of those?
I'm in Jasper now.
Oh yeah, you are, aren't you, you bastard? I forgot. You're not in Porter County. Oh, see.
But yeah,
No,
so
we well, and
that
here's
was
my
funny.
thing though. Anytime a government body, so they would create a taxing authority, right? And they're
Mhm.
like, oh, it's only what is it, like a 2% or
Yeah, it
10
was
2%,
it was
something low.
minimal. They said.
Well, I'm old enough to remember when the cigarette tax was awfully low too.
Oh
And
yeah.
all of a sudden they raised the cigarette tax because they were going to pay for children's health care. Well,
Yeah.
all of a sudden, well, we're not selling
Still
as many
37.
cigarettes. Well, you're not going to stop paying for children's health
not.
care, are you?
Right.
So
Right.
that's going to go to a different fund. So
Yeah. Yeah.
a 1% turns into 10%, turns into 25% real quick.
Yeah.
And so, and I'm a firm believer. Like, look, I'm not a Bears fan. I'm a Cowboys fan. But
Oh my gosh! At least you didn't say Packers.
Yeah.
That'd be the only thing worse.
Imagine
that's
walking
it. You
around
lost
and
my
he's going,
vote. I'm
he's
done.
going,
That's
"Dem
it.
boys, dem boys, dem boys."
Oh.
Listen, no, but I hate Jerry Jones. I hate Jerry Jones though. So I'm
Oh
a
yeah,
Cowboys
you
fan
have.
because
Okay. That's
because I
acceptable.
grew up with Troy Aikman and
Yeah.
like I grew up Emmett Smith. Somebody gave me a
He
Cowboys
grew up
jersey when I was
before the
knee high to his.
salary cap.
I did. I grew up before the salary cap.
Right.
Oh, I'm sorry. Were you alive in 1985, Keith? Oh,
Yeah,
when's
I
the last time
was.
the Bears did anything?
Well, see, that's
You
my.
were barely.
I'm originally from Chicago, from the south side of Chicago. So growing up, my parents went to high school with Dick Buckus. So
Oh, that's awesome.
So I came out of the womb, bleeding the appropriate blue and orange, not Denver blue and orange, Chicago blue and orange.
Yeah. It's a little different shade of orange though.
Yeah.
And don't get me wrong, like I always root for the home team. Like I always want the Bears to do good, unless they're playing the Cowboys. Then I'm like, but I still want the Bears.
Yeah.
I want the Colts to do well. I was rooting for Michigan in last night's game. I don't care about Michigan, but it's the
Yeah.
Midwest. So yeah.
Well,
hey,
yeah. If I had to
let's go
choose
Michigan.
between the two, yeah.
Yeah. It was the
Yeah.
first time that a Big Ten school has won
long
in
time.
however many years.
Yeah.
Oh, excuse
I
me.
think they said Michigan State was the last one before that.
Yeah, I think they said it was
Yeah.
like 2008
Yeah,
or
it was
something
a
like
while
that. It
ago.
was something crazy, and that was a good game. That was a good
Yeah.
game. So
Yeah. So
without going
happy to
too-
talk about the Bears whenever. Happy to talk.
Well,
You
sounds good.
all
Well,
of
hey, thank
you
you so much, Jody. We
no
appreciate you coming
problem.
on.
Thank you, guys. I
We've had a great
appreciate it.
time. We love doing these shows. Like I said, I'm gonna do all that stuff. We'll keep in touch with you, and
Okay,
yeah, I'm
perfect.
gonna
Yep.
get the
And I'm
link.
sure Dan will keep in touch with you too.
Oh yeah, for sure. Oh yeah, yeah. I'm sure. After talking to him now, knowing that he knows JR and stuff,
Yeah,
if he does any sort of golfing, I'm sure JR will bring him out to some
that's funny.
some golf stuff. So yeah, we'll hang. I'm sure.
Perfect.
So
Take your cholesterol medicine. Keith,
thank
don't have a heart attack.
try not to.
Okay,
Yes,
thank you.
yes, Dr. Allen. Yes,
Yes,
Dr.
yes.
Allen. All right. Well, I am
All right.
Travis Gearhart,
I'm Keith Cunningham.
and you are,
Dr. Jodi Allen.
and we are
Disenfranchised.
disenfranchised. I should have warned you about that. I'm sorry.